Hi everyone, Dr. Idaluca here, and I have a model of the low back. It's not anatomically correct, but it does show you how the discs bulge. And then over time, these joint spaces will get smaller as we get the arthritic change. And I'll show you that on a different model. But one of the things that you can kind of see is this disc will bulge right out and press right into that nerve. I don't know if you can see that. And when that disc bulges and presses in the nerve, it'll send pain right down that one side. Sometimes this disc will bulge straight back. There should be another disc on top of here. It'll bulge straight back right into the spinal cord itself, and then that can press right into the spinal cord, and then you get pain down both legs. But it's really common for it to go down. It's called posterolateral, which is just a nice way to say like northeast. It's not north, it's not east, it's northeast. It's posterolateral, backwards and lateral. And that disc will bulge backwards and lateral into one of the nerve roots. And that's what causes that disc pain down the leg. Please check out my other video where I showed what we do. We want to take, when that disc is bulging, it's usually because there's too many bricks in the truck, too much weight, too much injury, and over time that disc will press out and press back and bulge. So we want to lay the patient down and decompress that disc. Of course, we want to apply the right kind of chiropractic adjustments to the lower back to get the disc moving the way it's supposed to, get the facets, get the curves the way they're supposed to, and then talk to the patient about the right kind of alignment with their posture and muscles and the whole package. And so, but the primary reason of the pain oftentimes is radiating, let's say down the leg, for example, would be this disc bulges right into that nerve, and then that causes excruciating pain. How much pressure does it take on that nerve? How sensitive is the nerve? Well, it's basically like the front of your eye, like your cornea. How hard do I have to take my pen and press it into my eye before I'm not a happy camper? And the answer is not much. And so the studies say the weight of a dime, so however many grams a dime weighs, that much pressure on that nerve. And so the good news is if we can get any of the pressure off of the nerve, patient gets relief. And this is kind of like a light switch. It's either on or off. And so once we get that thing decompressed, patients do much, much better. So I have one of the models here. If you have questions, you can come into any of our offices, do a free consult with one of our doctors. If you know that you have a disc bulge, it's primarily because you probably have an MRI, and you can see this the best on MRI. Can you see a disc bulge on a plain x-ray? And the answer is no. We can see the space between the bones is less, and if you have screaming sciatica down your leg, we can make some assumptions, but the best way to really diagnose it is to look at the MRI, what they say about assumptions, right? And so we want to see your MRI, and patients are bringing them in regularly these days. And so you come in, do a consultation with one of our docs, and see if they can help you, see if there's something you have. Now, this disc can bulge all the way back, it can break off, and you can have a free-floating fragment in there. Can we help you then? The answer is no. I mean, the only person that can help you with that is a spine surgeon. Typically, they're going to take that free fragment out of there, especially if it's causing you problems. If it's not causing you any problems, then it's kind of between you and the spine surgeon how you want to manage that. But when this disc is bulging, it causes quite a bit of pain. How often do we see a free-floating fragment and a piece broken off floating in there? Not often, not often. That's usually the patient has let this go for a long time, like decades, or a severe injury, like they were a paratrooper and they hit the ground too hard or something like that. So a little bit about disc bulges, and take a look at my other video that deals with the decompression. Thanks so much.